Okay, so its chapter name is acid base balance, right? Acid and base. Acid means the solution what is contain hydrogen ion, and base means the solution that contain hydroxide ion. As I told you, I am going to this PowerPoint because of the my school curriculum, but what NCLEX board asks, I will figure it out. And you can trust me, this small information, what I will share with you about the question and answer in NCLEX, that should be super enough to answer the question for NCLEX. So hydrogen ion, acid and base. So hydrogen ion concentration is very important to figure out what is acid and what is the base. Hydrogen ion, shortly H plus, hydrogen ion. So hydrogen ion is vital for life because hydrogen ion determined the pH. Question comes, what is pH? pH actually mean is the hydrogen ion concentration. pH, okay, have to be optimal, have to be normal for your body chemical reaction. The normal pH is 7.35 to 7.45. So if the pH is less than 7.35, it is acidic. If it is pH is 7 more than 7.45, this is basic or alkaline. So the normal or neutral pH should be in between 7.35 to 7.45. So if your pH not in between this range, your body chemical reaction will not occur. Why? Because the enzyme is super important for any chemical reaction. Enzyme. Chemical reaction take place because of enzyme. And enzyme work when the pH is between 7.35 to 7.45. Enzyme is a protein. The protein will change the configuration if the pH less than 7.35 or pH more than 7.45. So the optimal pH or neutral pH is 7.35 to 7.45, where the enzyme can active for chemical reaction, and chemical reaction produce the energy in metabolism system inside our tissue or liver. Metabolism. So metabolism is a chemical reaction, and chemical reaction take place because of enzyme activity, and enzyme is super active when the pH is 7.35 to 7.45. What are the note from here? We have to know what are the normal pH level. Normal pH is 7.35 to 45. Second note, you have to know if the pH less than 7.35, it is called acidic. If pH is more than 7.45, this is called basic or alkaline. So hydrogen ion concentration. Actually, it is the pH, or definition of pH means it is the hydrogen ion concentration in the solution. So I'm going to read it for you. Expressed as a pH, the pH scale is determined by the number of hydrogen ion and goes from 1 to 14, and 7 is a considered neutral. 7 is the neutral, so the range is 7.35 to 45. The number of hydrogen ion in the body fluid determined whether it is acidic or alkaline, acid or acidosis, alkaline for alkalosis. So now go for what is acid. Acid means the produce as the end product of metabolism. So acid definitely contain the hydrogen ion more, and alkaline is contain the hydroxide more. They said acid is produced the end product of metabolism. So metabolism is a chemical reaction that takes place inside the liver and produce energy as ATP. And this ATP because of this ATP, you got up from the sleep, you wash your teeth, face, drive your car, and you came to school and sitting and listen me. So because of this ATP, and ATP come from metabolism. So now go next. Here, what is base? Base is the contain no hydrogen ion or contain the hydroxide ion. So hydrogen ion acceptor, they accept hydrogen ion from acid to neutralize or decrease the strength of a base or to form a weaker acid. Normal serum level of bicarbonate, shortly called BiCO3, hydrogen carbonate, bicarbonate. So here it is important the normal serum level of bicarbonate. So bicarbonate normal level is 21 to 28, and some books said the bicarbonate ion is 22 to 26. Some books said 22 to 26 millimole per liter. You see, millimole per liter, but also it is another unit is called milliequivalent per liter. So this is the note you have to know to answer the question in NCLEX board. If this asks what are the normal range of bicarbonate ion, it is 22 to 26 or 21 to 28 millimole or milliequivalent, right? It's bicarbonate ion. So bicarbonate ion take the hydrogen and make the solution neutralized or decrease the strength of a base to form a weaker acid. So now go here, what is buffer? So buffer actually a system, regulated system, or a solution. What is buffer? Buffer is a solution that can resist the high pH, that can resist pH change upon the addition of a acid or a basic component, and it is able to neutralize the small amount of added acid or a base. So buffer basically maintain the stability of pH of a solution, right, for relatively stable. So buffer is a provide the immediate protection again to change the hydrogen ion. So if your hydrogen are suddenly change in your body, means your body should be acidic, and acidic is not good. Also, if suddenly change too much less and basic increase, your body will be alkaline, and alkaline also not good. So as I told you, the normal pH 7.35 to 7.45, the pH should be normal because of buffer system. So buffer serves as a transport mechanism that carry excess hydrogen ion to the lungs. And also, once the primary buffer system react, they are consumed and they leaves the body less able to with the standard further trace until they are replaced. So what is buffer? I said buffer is the system that regulate or maintain the normal or optimal pH. So what next here? So there are some example of buffer. So primary buffer system in extracellular fluid. Extracellular fluid means the fluid outside the cell, right? So extracellular fluid like hemoglobin work as a buffer. Hemoglobin work as a buffer system. So systemic maintenance the acid base balance as a process called chloride shift. So hemoglobin system work as a buffer one, and now here another buffer system, the primary buffer system in extracellular, another buffer is called plasma protein buffer. So plasma protein also act as a buffer. So function along with the liver to vary the amount of hydrogen ion in the chemical structure of plasma protein. So we are talking about the buffer. What is buffer? Buffer is a solution that can maintain the normal optimum pH. So who work as a buffer? Who work as a buffer? Like your hemoglobin system work as a buffer. Your plasma protein in the blood work as a buffer, right? So another one primary buffer system is called carbonic acid bicarbonate system. They also work as a buffer. Carbonic acid bicarbonate. This is the mean form of right hydrogen CO3 bicarbonate and -1. So primary buffer system in the body, carbonic acid bicarbonate. So they said primary buffer, they maintain the normal pH 7.4. Also the ratio 20:1 determine the concentration of hydrogen ion in the body. And carbonic acid concentration controlled by the excretion of carbon dioxide by the lungs. So carbonic acid bicarbonate buffer work inside the lungs, right? So they eliminate the carbon dioxide from the body, help to eliminate. The kidney control bicarbonate as well, and concentration are selectively related, excrete bicarbonate ion. So to help or maintaining the normal body pH, your lungs work, your kidney work. So kidney and lungs is one most important vital organ. They can help our buffer system, right? Lungs help. So we call respiratory acidosis or respiratory alkalosis when lungs or respiratory system 1. When the kidney or our GIT help to eliminate the bicarbonate ion and or participation in acid-base balance, right? If they does not make a balance, we said imbalance, and imbalance is called metabolic acidosis and metabolic alkalosis. So I'm talking about here the kidney, the lungs, our GIT can help to acid-base balance. If they are not working well, acid-base imbalance occur. If you ask me, when they does not work, when you are the patient, like respiratory disease, asthma, or COPD, your lungs does not work well. Carbon dioxide accumulate and imbalance start. If the kidney failure, right, that times also imbalance occur, and we call either metabolic acidosis or metabolic alkalosis. Same as the GIT, too much vomiting or diarrhea, too much fluid loss, and imbalances occur, either metabolic acidosis or metabolic alkalosis. Both are the example of acid-base imbalance, right? So I'm talking about the liver, the kidney, the GIT help to maintain acid-base balance or help to maintain optimal pH level. So primary buffer, again, another buffer is called phosphate buffer system. Phosphate buffer. Okay. So presence in the cell and body fluid and especially active in the kidney. Phosphate buffer act like bicarbonate and neutralize excess hydrogen ion. So phosphate also work as a buffer. So regulatory system for hydrogen concentration in the lungs. So this is the more focus for the day. So what are the system or organ participate for maintaining hydrogen ion concentration? The first one is the lungs, right? The lungs. So lungs is a lungs the body second defense mechanism. So what are the normal function of the lungs? Definitely you will answer me, eliminate the carbon dioxide as a waste materials, or take the oxygen from the environment for the tissue nutrition. So lungs has an important function in the body. If our lungs does not work, our tissue will not get enough oxygen, and carbon dioxide is accumulate in the body and causes respiratory alkalosis or respiratory acidosis, right? So here I'm talking about the, just let me read it first, then we'll go. So the body's second defense mechanism is lungs. They interact with the buffer system to maintain acid-base balance. So in acidosis, means respiratory acidosis, the pH decrease and respiratory rate and depth increase in attempt to expel the acid. The carbonic acid created by neutralizing the acid of bicarbonate ion. Bicarbonate can be carried out the lungs, whereas it is reduce the carbon dioxide and water, and also help to exhale. Thus, the hydrogen ion are inactivated and also expel out. So In alkalosis, the pH increase and respiratory rate and depth is decreased. The carbon dioxide is related, and also carbonic acid decrease to neutralize or decrease the strength of excess bicarbonate ion. So here talking about the acid. So here talking about the acid, I mean lungs has an important role to maintain the normal acid-base balance. Okay, but here I'm talking about sometime NCLEX board asks the question about the blood gas interpretation. They give the number and you have to find out what are the problem. Okay, basically we follow one of the rules is called respiratory opposite and metabolic equal. I will explain this one, but at least from this page you have to know the importance of lungs, how they work to maintain the balance of carbon dioxide or hydrogen ion and help to stabilize acid-base balance. So make it easy here. In case of respiratory alkalosis, I will explain more. In case of respiratory alkalosis, especially patient breathing too fast. In case of respiratory alkalosis, patient breathing is too slow. If I make it easy, like a patient has asthma patient breathing actually slow, but a marathon runner I mean just running 100 meters, their breathing is so fast, and we can categorize respiratory alkalosis or respiratory acidosis. So lungs continue. Let me read it first, then I will explain more. The lungs can hold hydrogen ion until the deficit is corrected or be inactivated hydrogen ion. So the monitor for the client respiratory status, always we have to monitor the client for respiratory status. In acidosis, the respiratory rate and depth increase, right? We have to monitor the patient basically very carefully. In acidosis, I mean respiratory acidosis, the respiratory rate and depth increase in an attempt to exhale the acid. In alkalosis, the respiratory rate and depth decrease. Rate and depth decrease. Carbon dioxide is retained to neutralize the decrease the strength of excess. So basically, I want to tell you, just keep this to note that it can help you to understand later. Another is in alkalosis, there are two options, right? One is said in case of the respiratory acidosis, the respiratory rate and depth increase, right? But in alkalosis, the respiratory rate and depth decrease. It is opposite of the respiratory, not opposite. I said when the patient has respiratory rate and depth increase, actually patient breathing is slow little bit. But in case of alkalosis, when respiratory rate and depth is decreased, patient is trying to breathing too fast to compensate. Carbon dioxide is retained to neutralize and decrease the strength of excess bicarbonate ion. Now another, kidney system. How kidney help in the body for maintaining the acidosis or alkalosis. So how kidney? Basically, kidney when participate to compensatory system or GIT can participate, we tell metabolic problem. But when lungs participate, we said respiratory, either alkalosis or acidosis. But when kidney participate, we say metabolic alkalosis or acidosis. So the kidney provide a more inclusive corrective response to acid-base disturbance than other corrective mechanism. So compensate require a few hours to several days. However, it is not a more thorough or selective process than that of a other regulator such as the buffer system or the lungs. In acidosis, the pH is decreased and excess hydrogen ion are secreted in the tubules and combined with buffer for excretion in the urine. In alkalosis, the pH increase and decrease the bicarbonate ion and move into the tubules and bind with the sodium and excreted inside into the urine. So as I told you, like as an example, I said, I mean, a patient is a renal failure, kidney tubules does not work. I mean the renal failure. So keep in mind, a patient has an acute renal failure. Give an example. Renal failure means it does not involve the lungs problem, right? It does not involve the lungs problem. So we will not think about the respiratory alkalosis or respiratory acidosis, because kidney is not related with the lungs. Kidney related with your GIT, gastrointestinal system, related with, I said. So the problem should be either metabolic acidosis or metabolic alkalosis. So kidney is a part of our metabolic system. So if any patient is a kidney related problem, and if you talk about the metabolic, talk about the acidosis or alkalosis and kidney related, it would be metabolic problem, because I said they are not related to the lungs. Even something important, acute kidney failure or kidney problem, is not directly related with the vomiting or suctioning, because vomiting or diarrhea are purely related with the metabolic or GIT, but the kidney does not directly related with vomiting or diarrhea or any kind of suction, because kidney is a kidney, not GIT, gastrointestinal system, no. But I said sometimes question come like this: which blood gas value would you expect to see in a client with acute renal failure? Renal failure. We will answer more, but I'm talking about the when metabolic acidosis or alkalosis occur, kidney try to compensation. So the compensation required a few hours to several days. Compensation. When any abnormalities occur, our body try to compensate. Because like you have a problem, you do not go to the doctor office right now. You try to adjust. If your body is not enough, you have to call 911 and you have to go. You should go. But body always try to adjust with the problem. They try to auto correction. If not, we go. So compensation require a few hours to several days. However, it is a more thorough and selective process that of the other regulator, such as the buffer or lungs. In acidosis, pH decrease and excess hydrogen ion are secreted into the tubules and combined with the buffer or excretion in the urine. In alkalosis, the pH increase and excess bicarbonate ion move into the tubules and combined with sodium, right, and passes to the urine. So continuation, how kidney help in compensation. So kidney selective regulation of hydrogen bicarbonate ion in the kidney. Kidney restore bicarbonate by excreting hydrogen ion. Excess hydrogen ion are excreted in the urine, right? Now another important role by potassium in regulation of the hydrogen ion concentration in the body. So as you know that potassium is important ion, right? Positive ion. They play an exchange the role in maintaining the acid-base balance. The body changes the potassium level by drawing the hydrogen ion into the cell by pushing them out of the cell. So when hydrogen ion inside the cell, in exchange of one, potassium get out and causes the imbalance. So in acidosis, basically, the body protects itself from acidic state and moving hydrogen ion into the cell. Therefore, potassium move out and make room for hydrogen ion. And here, in case of alkalosis, the cell release hydrogen ion into the body and attempt to increase the body acidity. When the client is experiencing acid-base imbalance, monitor the potassium level closely because the potassium move in and out of the cell in attempt to maintain acid-base balance, and also resulting hypokalemia or hyperkalemia. So what we learn from here? We learn if your patient any chance of acid-base imbalance, we have to check the electrolyte level, especially potassium, because potassium, all of the electrolyte is important, but potassium is the most important. When acid-base imbalance occur, the potassium also causes the imbalance and they resulting hypokalemia or hyperkalemia. Hypo or hyper, both are bad and they causes the complication like arrhythmias. And if we does not correct the arrhythmia, patient can die because of heart failure or dysarrhythmias. There are some basic talk about the respiratory acidosis. Respiratory. So the body total concentration of buffer based is lower than normal, with a relatively increased the hydrogen ion concentration. Thus, the greater amount of hydrogen ion are circulating in the blood then can be absorbed in the buffer system. And also the client has a condition that causes the obstruction of the airway and depress the respiratory obstruction or depressed the respiratory system. Monitor the client for respiratory acidosis. So as I told you, if patient has any kind of acid gas imbalance or acid base imbalance or blood gas analysis imbalance, we can see we have to monitor carefully the respiratory system, because the lungs is important, play an important role to make a balance. What they said, if a client has a condition that causes an obstruction where your respiratory system, when obstruction occurs, like any asphyxia or aspiration something, or if your patient has any obstruction like COPD, bronchial asthma, obstruction is occur, obstruction of the airway or depressed the respiratory system, monitor for the client for respiratory acidosis, right? And also we have to collect the data. Data collection is super important in an attempt to compensate the respiratory rate and depth increase. So when any imbalance occurs, our kidney try to compensate, our lungs try to compensate as well, because the kidney, lungs play a very important role to maintain the normal acid-base balance. So respiratory acidosis here, acidosis, if your patient have a respiratory acidosis, okay, what as a RN, what you have to do, what you should do. Basically, respiratory acidosis occur when the pH level less than 7.35 and bicarbonate ion, partial pressure of carbon dioxide, more than 45 millimeter of mercury, more than I said. Respiratory acidosis. Whatever if your patient has a respiratory acidosis, as a RN, what you have to do, this is you have to know for board exam. As a RN, what we have to monitor for the sign of respiratory distress. Admits oxygen as prescribed. Place the client semipolar, encouraging and assist the client to turn, cough, and deep breathing. Encouraging hydrogen to thin the secretion, reduce the restlessness by improving the ventilation, prepare to assist and maintain respiratory treatment as prescribed, and also suction for the client airway if necessary. So what if, like your patient has a respiratory acidosis, like you went for blood gas analysis, definitely we have to know what are the normal blood gas, means pH, partial pressure of oxygen, partial pressure of carbon dioxide, bicarbonate ion. We have to know normal. If you know what is normal, then it will be easy for you to find out the abnormal. So in this pages, PowerPoint pages, we are talking about the respiratory acidosis. Respiratory acidosis, as I told you, in blood gas analysis, if you get the pH less than 7.35, but partial pressure of carbon dioxide is more than 45 millimole per mercury, you can say my patient has a respiratory acidosis. If your patient has a respiratory acidosis, how we have to take care of them or what we have to do, right? And as I told you, if your patient has a renal failure, patient must have any kind of problem, either respiratory acidosis or alkalosis. We are going to explain all, but here I'm saying what are our first priorities. First priority, monitor the sign of respiratory distress. One, give oxygen. Patient position is important. It should be semi-polar. We have to encouraging to turn or cough or deep breathing. Courage for hydration, right? Reduce the restlessness, because when patient is undergo to the respiratory acidosis, definitely they will be restless, right? Restless. Also, we have to check to assist to determine respiratory treatment. Also, any kind of secretion we have to remove from the lungs. Respiratory acidosis continuation here. So monitor the electrolyte balance. Electrolyte means potassium, sodium, phosphorus. Assist to admin antibiotic for respiratory infection. And also prepare the assist for endotracheal intubation, right? Endotracheal intubation or mechanical ventilation. It depends upon patient condition. If they're really bad, we have to do it. Now go for if your patient has a respiratory alkalosis, right? How you have to know respiratory alkalosis? The major thing is we have to know when we can see the patient have a pH is more than 7.45, but the partial pressure carbon dioxide is less than 35. Less than 35, we can say my patient has a respiratory alkalosis, right? So if your patient has a respiratory alkalosis as a RN or LPN, how we has to manage the patient, right? We are talking about here. But before to go next level, I'm talking about the respiratory alkalosis. Patient undergo hyperventilation, respiratory alkalosis. Hyperventilation, why? Hyperventilation due to maybe because of extreme anxiety, extreme restlessness. So like I said, a big dog is running on behind of you and there are nobody can help you. Your respiratory go up, right? Because of super anxiety. Breathing will be too fast. So your body should temperature go up, temperature. So in some medical condition like extreme anxiety or when body temperatures go up, if your body go hypoxia or any kind of like salicylic overdose, in that condition, patient has to follow respiratory alkalosis. Respiratory alkalosis. So When your patient has a respiratory alkalosis, right, what we have to do, or I said, let me finish it first. Use the respiratory alkalosis patient has some common sign and symptom from to see you can find out. You say the cause, what I explained, some data collection. What are the data? Data means you have to analyze the blood gas level. When you go analysis blood gas level, you can see the pH more than 7.45 and partial pressure of carbon is less than 35. Also, patient has some of the sign and symptom. They are like complain of shortness of breath, like respiratory alkalosis, shortness of breath. The shortness of breath also present in respiratory acidosis. In case of respiratory alkalosis, patients sometimes complain of headache, okay, or paresthesia, excessive hydrogen, paresthesia, numbness, difficulty of concentration, blur of vision, or hypokalemia. This is the data. But if your patient has respiratory alkalosis, not no, if patient has respiratory acidosis, usually patient increase the pulse rate but decrease the respiratory rate. Patient also complain dizziness, confusion, level of consciousness is go down. And in chronic condition, they have a problem of weakness or headache. Headache is common both respiratory acidosis and respiratory alkalosis. Shortness of breath common in respiratory acidosis or respiratory alkalosis. As I told you, if we go and compare and contrast, I can tell you the respiratory alkalosis breathing is too fast. Hyperventilation due to the extreme anxiety, extreme body temperature, hypoxia, or salicylate overdose. In case of respiratory acidosis, the breathing is too slow and patient actually complain of acute lungs condition that impair the alveolar gas exchange. The most common disease is pneumonia, pulmonary edema, or chronic lungs disease like asthma. So if you ask me, make easy for the NCLEX board, as I told you, in case of like here, acidosis, respiratory acidosis, example of any kind of acute lung condition or lungs impair alveolar gas exchange, pneumonia, pulmonary edema, or any foreign body aspiration, chronic lungs disease like asthma, cystic fibrosis, everybody has a respiratory acidosis. Where is the respiratory alkalosis? I said, if your patient is a hyperventilation condition. When hyperventilation, if extreme anxiety, elevate the body temperature, hypoxic condition, or salicylate overdose. If you feel everything is so hard, I can tell you, just blindly remember all kind of respiratory chronic disease is a respiratory acidosis. Respiratory acidosis. Whatever, if your patient has a respiratory alkalosis, what are the intervention. As I told you, intervention is super important because we are LPN or RN. Intervention in case of respiratory alkalosis, right? We already read that what are the intervention of respiratory acidosis. We are just going to talk about the intervention of respiratory alkalosis. We have to monitor the vital sign and blood gas analysis, right? It is same for respiratory acidosis. Both case we have to monitor the vital sign. Nobody can tell you, oh, don't check my vital sign. It is safe for you, safe for the patient. Also, you have assist the client to breathing more slowly or help the client breathing in a paper bag to apply a rebreathing marks. It is called rebreathing marks to inhale carbon dioxide. Let me read it with you. Intervention: monitor the sign of respiratory distress, prevent emotional support, assist the breathing technique, right? Also, voluntary holding the breath, use the rebreathing marks, or use a paper bag if nothing is there, or apply the rebreath marks. Carbon dioxide breathing is prescribed. Monitor the ventilator client to be sure that they are not forced to take the breathing too deeply or rapidly. Monitor the electrolyte, vital sign, and blood gas analysis, right? And calcium gluconate may be prescribed if your patient has a tetany, right? If. So what next? Next, metabolic. So metabolic acidosis and metabolic alkalosis, right? Important for you. So metabolic acidosis, it is the most common, it is most common during renal failure, metabolic acidosis, or diabetic patient. NCLEX board asks a question: renal failure patient, what is your diagnosis? Metabolic acidosis. Diabetic patient, metabolic acidosis, right? Diarrhea, metabolic acidosis. Diarrhea means lose watery stool through your anus, large part of GIT, right? So all of this is the example of metabolic acidosis. And this is the causes basically, right? Causes. What are the data collection? Question, it is super important for your board exam. Super important, I say. So sign and symptom of data collection. So if you go blood gas analysis, we can get the pH is less than 7.35, but bicarbonate should be less than 22. Usually patient has a, I'm talking about the data collection of sign and symptom. Usually patient have lethargy, confusion, headache. Remember, headache is common in respiratory acidosis and respiratory alkalosis both. Patient complain of nausea, vomiting, or weakness. It is very common. If you have a vomiting, you will feel weakness, lethargy. If it not treated, confusion. The patient has a very rapid and deep respiration, and this is called Kussmaul respiration. NCLEX board asks, what type of respiration is metabolic acidosis? It is Kussmaul respiration. Sometimes say, what type of respiration in metabolic acidosis? It is deep rapid respiration, and deep and rapid respiration is called Kussmaul respiration. What are the other conditions Kussmaul respiration is occur? In case of uncontrolled diabetes mellitus, and it's called diabetic acidosis. Kussmaul, super duper important for NCLEX board. So now go the intervention. What you has to do? What are the intervention? Right? Intervention, you have to monitor the level of consciousness for the patient. You have to monitor, right? And also strictly maintain input and output. Admin IV sodium bicarbonate is prescribed. Whatever is prescribed, always the answer, right? And treat underlying problem. So let me read it with you in these pages. Monitor for the sign of respiratory distress. Check the level of consciousness, shortly called LOC, right? Level of consciousness. Monitor input, output, how much fluid you take, and what are the total P, total amount of P. Inputs, initial safety and seizure precursor, if any. Monitor the potassium level closely, as metabolic acidosis, potassium move back into the cell. All electrolyte maintain check is important. Not only potassium, but potassium is super important because they causes dysarrhythmias, and dysarrhythmia lead to the arrhythmia and patient die. So monitor the client experience severe diarrhea, because severe diarrhea can cause metabolic acidosis, but severe vomiting can cause metabolic alkalosis, right? Super important. Commonly asking question in the NCLEX board. So metabolic acidosis here, what are the metabolic acidosis intervention, right? Intervention, intervention of the diochem. So if the metabolic acidosis because of diabetic, means diabetes insipidus, what are the management? And the patient who have the uncontrolled diabetic mellitus and causes the metabolic acidosis, and this is called diabetic ketoacidosis. So if your patient has a diabetic ketoacidosis, give the insulin as prescribed. As prescribed is always the answer, right? In the board. When glucose is begin properly metabolized, the body stopped to converting the fat to glucose. Monitor the circulatory collapse and caused by polyuria. Intervention for the kidney problem, if it is caused by the kidney. Dialysis may be used to remove the protein and waste product, right? A diet is low in the protein and high in the calorie and decrease the amount of protein waste product. So every line is important from these pages. So when you go through, I make some boxes. It can help you to figure out what need for the board exam. And on the same time, I'm telling again, this is need, this is do not need. Now go for metabolic alkalosis. So metabolic alkalosis, usually it is problem is occurred if excess acid loss through the GI tract, like vomiting. So if you too much vomit, means you fluid loss, and patient face metabolic alkalosis. But if you fluid loss through the terminal part of GI, like diarrhea, metabolic acidosis, renal failure, metabolic acidosis, diabetic mellitus, metabolic acidosis. But metabolic alkalosis, I said excess fluid loss, like vomiting, gastric suctioning, or excess use of potassium wasting diuretics. Potassium wasting diuretics, what are the name? Fusamide, loop diuretics, Lasix, excess P, and causes metabolic alkalosis. Or some of the endocrine disease like Cushing syndrome, hyperaldosteronism, or excessive bicarbonate intake from antacid or parental sodium bicarbonate also causes metabolic alkalosis. So data collection, data means sign and symptom of metabolic alkalosis. So if we go and check blood gas analysis, we can get the pH 7.4. pH should be more than 7.45, but sodium bicarbonate more than 26. So sodium bicarbonate and pH more than the normal, more than the upper limit, upper the normal range, right? What is the pH or sodium bicarbonate in case of metabolic acidosis? Both are less than normal. So what else? What are the other acid-base balance? I mean, sign symptom of metabolic acidosis. Patient decrease the respiratory rate and death. And also patient complain of dizziness, or patient complain of hypokalemia or sarcomoral paresthesia, like paresthesia means abnormal sensation, or patient complain of numbness, tingling sensation, or tetany. So compensation or respiratory rate and depth decrease. Monitor the client experiencing excess vomiting or the client gastrointestinal suction for manifestation of metabolic acidosis. So as a RN or LPN, what is your responsibilities for the patient? What is your responsibilities for the patient? I said. So we have to monitor input and output like metabolic acidosis, and also we have to monitor the vital signs, especially respiratory, and we have to check for level of consciousness like metabolic acidosis. Both cases same, right? Monitor input output, monitor vital sign, monitor for the level of consciousness. And in case of metabolic acid alkalosis, we have to admit IV fluid as prescribed and treat underlying problem. Let me read it. Monitor for the sign of respiratory distress, monitor the potassium and calcium level. Also, safety precaution we have to follow. and medication or intravenous fluid or promote the kidney excrete the bicarbonate, prepare assist the potassium replacement, and also underlying cause of alkalosis must be treated. So what next? What next? Here, acid arterial blood gas analysis from here. So let me show you.